wonderful thing about the way we treat cancer today is that no longer is cancer a death sentence. So it has become more of a chronic disease in some ways.
And so that really requires a new model. It's not a model of day-to-day life and death decisions made about treatment. It's really a model of how to get the patient to re-engage back into their life.
We have developed and launched a new model of cancer care, which we call CaLM, Cancer Life reiMagined.
What we're doing with CaLM is taking the very best of what we've learned about how to support patients with cancer and their families and pulling it all into one space.
I like to think of it as a flipped model. So instead of me, the oncologist, seeing the patient in a central clinic and then referring them out all over the place for social services or other things, in fact, it's the other way.
The providers are a team, and they come together and they sort of wrap around the patients. And that means that the patients don't have to go running all over town or even outside of town to get the care and support that they need.
We start with our SWAT team, is what we call it, a group of people who get to know that person as an individual and find out what are their personal goals and understanding what's important to them.
We've built that as patients and families sort of cancer medical home. And then we plug subspecialists into that model.
We have multidisciplinary teams that actually are putting together ideas to make the best treatment recommendations.
We're all in what we call the bullpen. We're all sitting together and communicating in real time about things.
The hierarchy is gone, and that's a good thing because we're all experts in our field.
We're asking questions of each other and trying to pull the best parts out of each other.
Once we've come to that consensus, then we want to be able to go upstairs and give that information to the person and to their family and give that individual the opportunity to speak with any of the specialists that are there.
And then we lay alongside that doctors who are specifically trained in taking care of people with illness and managing their symptoms in the most expert way possible. And we lay alongside that social workers and psychologists and physical therapists and dietitians and all of the other cadre of people that this patient might need in their cancer journey.
Here, when you enter the threshold for your medical care, those services are present.
LIVESTRONG Cancer Institutes clinic opened just a few weeks ago. We've been open since late December 2018, and the CaLM model is up and running, and we're really excited to be incubating it and seeing it start to take shape.
If I had to describe the CaLM concept in one word, I would use the word inclusive.
Supportive.
Empathetic.
Caring.
United.
Compassion.
Commitment. Collaborative.
The CaLM model is not just about curing the patient. The CaLM model is about human beings. It's about addressing the whole person.
We want people to live longer, and we want them to defeat cancer, but we also want them to live well. And the CaLM model says we should aim for both. We're creating a new construct to make it easier to get that comprehensive care and that support that undergirds everything else that needs to be done to make things better for patients.